Hello, everyone. Jonathan Maness here, President of Maness Veteran Medical. And today we're continuing our discussion about the Diowave laser. And I'm very proud to let everyone know I have Dr. Jesse Hatgis here with me. And he's going to go over and discuss his in real life experiences with the laser and some of the different things that he's experienced out here in the field. But I'm going to go ahead and bring him up now. Hello, Dr. Hatgis.
Hi, how's it going?
Going great. Thank you so much for spending some time with us tonight. And as you know, we're continuing to let the VA and the DoD know about what's going on here with the Diowave. So if you would just hop right in, let everyone know about yourself, your background, and some of your experiences. And we'll have a little conversation back and forth about this.
Sure. So first of all, thank you for having me. Thank you for everything that you've done as a veteran and everything you're continuing to do to help veterans out. I am a double board certified pain management physician. I did a residency in physical medicine rehabilitation for 4 years, followed by 1 year fellowship in interventional pain management, and continuing to learn, continuing to get involved with utilization of a bunch of different techniques and devices, one of them being Diowave. So Diowave has been a tremendously successful part of my practice that I employed a couple months ago, and it's really changed how I really use a lot of treatments in conjunction with this. So, for instance, I have um, a highly a high chronic pain population. So we have people that have almost every joint of their body having some sort of trauma or some sort of arthritis or something happening there. So we're kind of continuing chasing certain areas. So somebody might be treating for shoulder pain, but then we have to jump to their knee pain. And then after that, we have to get to their back pain and then their neck pain. And we kind of see this treatment with Diolave being something that is not caustic. It's something that you could do continuously. You could do it several times a week. You could do it 52 weeks a year if you want to. It's not like a steroid injection where you're limited to only having maybe two or three a year in certain areas of your body. Otherwise, it's going to be detrimental. So these are things that really are, I mean, very healthy. There are very few contraindications to being able to use it. And it's something that we see really great success doing. Um, the treatment is not painful at all. There's not even any heat produced from the treatment. So it's something that people just really lay there and they get treated and they feel better typically after the treatment is over and the effects are longer lasting. So this is something where I do for patients, especially when I see them the first time in my office and maybe I order a certain procedure for them and it's going to take them 2 to 4 weeks to get the procedure. And they say, "Oh man, I thought I was coming in here today and I was going to feel better today. What could you do for me today?" And I say, "Well, I have this laser. And if you want to do the treatment within the area that you're having pain in, we could do something for you today because it's cash pay. It has nothing to do with insurance. And we're able to get you in immediately. You don't have to prepare for the procedure at all. You don't have to be off of blood thinners. You could just get it done. If you have 10 to 15 minutes, we'll do it right now." So it's
And
really
what
something. I'm sorry, go ahead.
I'm sorry. What are when people come to your office and are in need of this? What are some of their symptoms? I know the laser helps with diabetes. It helps with pain massively. But what are you seeing out there in the field?
Most for me, most of the time, it's going to be something related to pain. So the majority of the patients that I see are going to have neck pain, back pain, some of the large joints such as shoulders, hips, and knees. We do see a lot of neuropathy as well. So we will treat neuropathy typically in the feet, but sometimes in the hands as well. So those are really the big ticket items from my clinic for what we see.
And from your expertise, how difficult is it to operate this laser in this system?
On a scale of 0 to 10, with 10 being extremely difficult, zero being not difficult at all, I would give it a zero point 0.5. It's highly, it's easily trainable. I mean, anybody within 2 to 5 minutes could get trained on this, from medical assistants to nurses to physician assistants, nurse practitioners, really anybody in the office can do this. It's extremely self-explanatory.
And the reason why I'm asking this at the VA, when I'm in the VA, they say, look, man, I need you to get me something that can save me time, that it doesn't take forever to train our staff. And in your opinion, this definitely fits that bill. You can get it in, do a 10-minute training, and they can get to work, correct?
I literally trained somebody this morning, and it took about 2.5 minutes to fully train them. And we had them do a patient, and everything went flawlessly.
That is outstanding. So tell me, what is the difference? And I'm getting this question all the time from the VA, so I want to know it from your mouth as a doctor. What is the difference in the Diowave and a lot of these other systems out here, in your opinion?
Sure. So there's a few things. So this is a class 4 laser. It's infrared light, and it is very high dose. So what does that mean in common terms? That essentially means that it's going to penetrate deeply. And why is that important? One, for the fact that if you have arthritis, let's say deep in your spine, and you have to get inches in, it's not going to be a laser that's only able to penetrate an inch or two and then get caught up in some of the soft tissues, more superficial tissues, and create heat, and not actually get any of that benefit down really to the core of where it needs to go. So this is able to do it in a more direct fashion and really get more power, hence more light, more treatment to the areas that are really in need. That to me is probably the biggest thing here. The operability of the laser is very simple, as you can see in the background picture that you have. It's a very small, easy to handle probe that emanates the light from there, and it's something that somebody literally could just hold and place on any region of the body. It's not machine dependent, meaning it's not like a robot or some other sort of mechanism that is going to have to stay there. And if the patient moves, it could be completely out of the treatment zone because the laser is not pointed over that region anymore. So it's operator dependent. I like the fact that somebody's in the room with the patient all the time. They could talk about where exactly the pain is. Maybe the pain will shift, or as the patient is laying there or seated there for a position of or for a period of time, the pain could change. So then the operator could obviously adjust the treatment to adjust where the pain is as well. The laser is built in with an AI algorithm. So it's based off of the location of the pain. So the treatment will be different, let's say, if it's in the shoulder versus in the neck versus the ankle. So there's algorithms that the people over at Diowave have developed for over 20 years in order to have the proper treatments with the proper power, the proper wavelength, the proper pulse width, all these different parameters that bore most people to talk about, but they've very much perfected per region what it should be. And then there's also an adjustment based on the current pain level. So on that numeric rating scale score of 0 to 10, 0 being no pain, 10 being excruciating pain, what is that patient currently at? That also fits into this algorithm. So there's a lot of, factors that are patient dependent within this. It's not just a point or shoot. It is very much tailor made towards the patient, but it's also very easy in terms of programming these things. It's really hitting about 5 or 6 different buttons prior to starting the treatment. And then once the treatment commences, really it's just a point and shoot. And that's it. It's very self explanatory.
That's
The
outstanding.
the machine
Doctor,
itself, I was going to say one more thing too, just with the
go
machine
ahead.
itself, that it builds per patient. So if you are on treatment number 2 or treatment number 10, it saves everything for that patient that's built in there. So we know kind of how the progression occurs and what that patient was able to handle, what they've had last time, what their response is to the treatment last time. And that's also factored into the algorithm henceforth.
Outstanding, Dr. Hatches. And we had this conversation a little bit ago, but we both kind of feel the same way. if we can get these veterans, get these patients off of daily medication, pain medication, things of that matter, that's what we're shooting for. These are different methods where veterans can take advantage of this. Now, can you please let everyone know, in your opinion, about how effective this has been in lieu of medicine like that, daily medication, and how long does it normally last for when you get a treatment with the Diowave?
Absolutely. So my answer will be very similar to really any other question in terms I get for how long does a treatment last. Everyone's going to be different, right? You'll have some patients that do this and they won't have any relief on the exact day that it's done. And then over time, they'll say, you know what? Actually, over this past week, I did gradually feel better because sometimes with the mechanism here, it's not immediate. There's a lot of things that are occurring on a cellular level that need to actually take place. And we know that these processes do take time in order to manifest. And that could be whether multiple treatments are needed or even just from one or two treatments, just the way that the body has to recompose itself. That does take some time. But we do get people that come in and they're 9 or 10 out of 10 pain and they leave with 0 or 1 out of 10 pain also. So it really just depends on the amount of chronic inflammation present, what the condition is, how bad that condition is. There's a plethora of things that are involved here with that. But we do have people that are very happy with it. Here or there, you'll get some people that don't respond. But even if they don't respond, it's not like they're taking drugs or they're doing anything that's going to be potentially detrimental to their body to do this.
And one last question I have for this session, Dr. Hatches. What is actually happening when you utilize a laser? Let people understand, especially veterans that don't have any idea, and people who may have those questions. Could you please answer that question? What is taking place in the body?
Sure. So, unlike anything else, unlike injections, unlike um, medications, this is purely energy that is getting into a certain region of the body. It is infrared light that penetrates very deeply. What happens on a cellular level is that light will essentially spur on the process of generating more ATP, adenosine triphosphate. Anyone who's taken a biology course in high school or beyond might remember that term. And that is really what drives energy. And that's what also drives cellular processes. So when we're talking about an immune system, when we're talking about inflammation, at a cellular level, these things are out of control, right? And with this light therapy, it's going to basically change those processes through that mechanism. So we're able to decrease inflammation, decrease pain, increase energy, really increase wound healing ability. There's just a lot of mechanisms that are beneficial because of what occurs on a cellular level that we're able to then see the benefits both potentially immediately as well as further on down the road.
Outstanding. Thank you so much. Dr. Hatchett, do you have any other immediate topics that you wanted to tell possibly the VA and the DoD as we distribute this out throughout the country? Anything on the top of your mind here before we wrap this up?
I think in regards to pain management, this itself is really something very different that I think the VA should consider implementing. If we want to stray off the subject of pain, we have other things we could talk about as well, or we could save that for another time.
Well, everyone, we are going to dig deeper here. We'll probably do 2 or 3 videos with Dr. Hatches, but today I'm going to keep this one kind of short so I can get this one out, and you can continue to grow with us. But if you ever want to try Diowave, just reach out to Maness Veteran Medical, the One Leg Bandit at manessveteranmedical.com. We will gladly send you a demo unit so you can try it out. Dr. Hatches, you do believe this as well. If they try this, they will understand what we're talking about, correct?
Absolutely. I had to be, quite honestly, somebody who saw it and saw the results and used it in my clinic in order to really fully understand how good this treatment is. Seeing it is believing it. And I'll lend my services too if you get connected with Jonathan and you really want a physician perspective on this. I'll be more than happy to connect with you as well and chat with you further about my experience.
Outstanding. Y'all just email me and we'll get together and get you any answers that you need. Dr. Hatgis, thank you so very much for spending time with us. We will do this a couple more times if you're fine with that. And I hope you have a wonderful night. Thank you very much.
Absolutely. My pleasure, and same to you.
Everyone, thank you so much for your time tonight. When you're sitting there, when you get to watch this movie, we're going to, this video, we're going to share it out on LinkedIn, everywhere we normally do. Please reach out to us, okay? Maness Veteran Medical is all about getting this type of technology out there to our veterans, okay? We want to get them off of pain medication. And I'm sure, 95% of the doctors that I speak with at the VA feel the exact same way. This is a solution for you, and that's what we're bringing to you. So anything you need, we're here for you. Hope you have a wonderful night. Again, the One Leg Bandit at ManessVeteranMedical.com. Hope you have a good night. Thank you very much for your time.